Okay, everybody. So Twitter is lit. Pfizer is trending because they released some more of their pharmacovigilance data today. And of course, anti-vaxxers are going off the rails, misrepresenting all of the data and trying to fearmonger as usual. So let's take this step by step. So for reference, this is the document they're talking about, cumulative analysis of post-authorized adverse event reports of the Pfizer vaccine received through February 28th of 2021. Now, of course, people are only focusing on the pages where they list just all the adverse events and saying, look at all these side effects, how could you possibly want to take this vaccine? But they fail, as always, to put it in the appropriate clinical context by reading the whole document. And I'll bring your attention to this paragraph up here because many external factors influence whether or not an adverse event is reported. The spontaneous reporting system yields reporting proportions, not incidence rates. As a result, it is generally not appropriate to make between-drug comparisons using these proportions. The spontaneous reporting system should be used for signal detection rather than hypothesis testing. This is where it says a lot of things may be missing from the report. An accumulation of adverse events does not necessarily indicate that a particular adverse event was caused by the drug. Rather, the event may be due to an underlying disease or some other factor or factors such as past medical history or concomitant medication. So essentially, this is Pfizer's personal version of theirs. And it's another way that we can collect safety data on these vaccines. So you can't say that these vaccines weren't tested or that safety data isn't collected because it clearly is. And if you go through the adverse events by organ system, at the end of each one, there'll be this line that says, conclusion, the cumulative case review does not raise any safety issues. Surveillance will continue. And of course, they leave out this part that says the data do not reveal any novel safety concerns or risks requiring label change and support a favorable benefit-risk profile for these vaccines. And then they go on to list all the adverse events that, again, were not necessarily related to the vaccine, that they just occurred after the vaccine and were reported to the surveillance system. And this represents millions of doses administered in over 60 countries. I mean, this is another medication with all of its adverse events listed. So would you want to take a medication that can cause arthralgias, lymphadenitis, dermatologic reactions, urticaria, edema, or things like abdominal distension, abnormal gait, abnormal sensation in the eyes, coma, confusion, conjunctival hemorrhage, asthma, fecal incontinence, hypotension, increased serum bilirubin, myalgia, neck pain, posterior uveitis, Stevens-Johnson syndrome, toxic epidermal necrolysis, basically your skin just sloughs off, vertigo, vomiting, weakness. It sounds horrible. Who would ever want to take this medication? So those were all the adverse events reported to the pharmacovigilance data collection system for ivermectin. And y'all seem to love that medication, right? Can we just stop with this nonsense, please?